Critical care nursing. Introduction. Critical care nursing is a nursing specialty that focuses on the care of patients who are critically ill, unstable, or post-surgical. With invention of various life-saving gadgets and development of technology, management of the critically ill has become more sophisticated. The intricate nature of critical care necessitates advanced preparation and specialized training of nurses to deal with the critically ill. Intensive care uses an array of gadgets that provide support of failing organ systems, particularly the lungs, cardiovascular system, and kidneys. Marshall, Bosco, ed. Hikari, et. 2017. Definition. Critical care nursing is a well-developed specialty of nursing that focuses on care of patients with life-threatening health problems requiring continuous monitoring and advanced treatment. Intensive care, also known as critical care, is a multidisciplinary and interprofessional specialty dedicated to the comprehensive management of patients having, or at risk of developing, acute, life-threatening organ dysfunction. Critical care is medical care for people who have life-threatening injuries and illnesses. It usually takes place in an intensive care unit, ICU. Critically ill patients are those who are at risk for actual, or potential life-threatening health problems. Concept of critical care. The concept of critical care was introduced by Miss Florence Nightingale in the 1800s. During the Crimean War, she created a space adjacent to the nurses' station and pooled all the soldiers with severe injuries, thereby enabling the nurses to monitor and care for them more intensively. The precursor concept of Nightingale was enriched and advanced to critical care nursing in the current days. During the polio epidemic in 1952, the first intensive care unit, ICU, was organized in Copenhagen. The polio-afflicted patients were nursed in iron lungs. Within the subsequent decades, in most of the European countries and America, ICUs were developed. Now the critical care units are an integral part of any healthcare facility. In the 1960s, physicians started having training in critical care such as coronary care, nephrology, and postoperative care. Alongside, the nurses also started having additional training in critical care. Having specialized skill sets and knowledge, nurses started giving emergency resuscitation and assumed the expanded roles. Today, the critical care is collaborative care rendered by the team consisting of intensivist, other specialists, critical care nurses, critical care nurse specialist, and other trained allied health personnel. Principles of critical care nursing. Astute assessment and continuous monitoring. Nurses need to be smart in making quick but accurate assessment of patient status. The dynamic nature of alterations in vital organ functions warrants early identification and treatment. Delay in identification and initiation of appropriate intervention may lead to catastrophic consequences. By virtue of the specialized training, critical care nurses monitor closely and continuously the critically ill patients. Critical care nurses must apply the advanced assessment skills and carefully observe the cardiopulmonary, neurological, and renal system functions and document these parameters from time to time. Proficiency in advanced assessment and complex procedures. Understand competency in handling gadgets such as ventilators, hemodynamic monitors, defibrillators, extracorporeal membrane oxygenator, ECMO, machine, bedside analysis unit, and intra-aortic balloon pump forms a core component of critical care nursing skills. Anticipation of complications. Anticipation and identification of evolving complications facilitates timely intervention to avert deterioration in the patient's condition. Critical care nurse collaborates with the critical care consultants, other specialist physicians, and other health team members. Utilizing the specialized advanced knowledge and critical thinking, nurses analyze the trends in various parameters and distinguish early the deviations and alerting parameters of complications. Critical care nurse initiates proactive measures using the evidence-based guidelines, critical care pathways, and care bundles before complications erupt as a consequence of aggressive management of critical condition and use of technology. Nurses need to be aware of and vigilant for possible unexpected outcomes, anticipate adverse reaction, and monitor for side effects for best outcome. Initiation of infection care bundles, deep vein thrombosis prophylaxis, pressure ulcer prevention, sepsis prevention bundle, and delirium prevention bundles are to be implemented efficiently to ensure quality care. Collaboration. Critical care warrants a team approach, and every member of the team deserves recognition for his or her irreplaceable contribution for the provision of high-quality critical care. Patients may get admitted to the critical care unit with life-threatening single organ or multiple organ dysfunction. Prompt diagnosis of critical illness, initiation of treatment, and evaluation of the effectiveness of medical and nursing intervention need perfect collaboration and team approach. Critical care nurses in association with other team members take active participation to salvage the patient. If even one member breaches the standardized protocols, the success becomes immaterial. Contribution of every member of the team, including the housekeeping personnel, is mandatory for successful infection control. All those involved in the care of the critically ill have to be abreast of the latest protocols and new changes in policies and guidelines. Periodic training and induction training of all categories of workers are essential for quality care. Comprehensive care. Provide comprehensive care by applying independent and interdependent nursing interventions, including selected proven alternative care modalities. Most of the patients in ICU may be incapable of complaining their pain, fatigue, or anxiety. Prompt pain assessment. Implementation of non-pharmacological measures to improve comfort and alleviate anxiety, prevention of bed sore, emotional support, and reassurance to the suffering patients and family are essential elements for quick recovery. Communication. Skillful communication within the critical care team is the basis of all quality care in ICU. It facilitates smooth functioning of ICU team and prevents the patient safety mishaps. Proper communication within the nursing team members leads to quality outcomes. Standardized communication between handoffs can provide smooth continuous care. Because of the critical nature of illness, patients may not communicate verbally, or may present with altered consciousness. Reassurance and informing them of the elements of care and their purposes go a long way in improving patient satisfaction and cooperation. Uncertainty thrown upon their face may lead to shock state in many family members. Communicate with the patient and family members truthfully and empathetically. Convey compassion and communicate in such a way that the patient's and family members' anxiety and stress are diminished. Nurses have to apply strategic communication technique to help solve the crisis, and in deserving special occasions, collaborate with clinical psychologists/counselor with advanced crisis intervention techniques. Ethical and humanistic care. The critical care environment is frightening to almost all critically ill patients and their relatives. The human dimensions of care, such as love, sense of belonging, and making sense of the intervention by involving the patient to the extent possible to him or her, are essential elements in the ICUs that cannot be compromised for high-tech care. ICU is the area in any healthcare facility where the greatest number of deaths and disability occur. Handling death or serious loss of body function is complicated and requires competency and delicacy in handling the bereaved ones. Breaking bad news has to follow a certain protocol so that the bereaved family members are supported well physically, emotionally, and spiritually. Nurses help in meeting the spiritual needs of the dying patients according to their beliefs and cultural norms. Roles and responsibilities of critical care nurse. Critical care nurses, CCNs, provide advanced care to patients in intensive care units, ICUs, emergency rooms, ERS, and other areas of the healthcare system. Their role includes assessing and treating patients. CCNs evaluate patients' conditions, start treatment, and monitor them. They may also clean wounds, take vital signs, and set up IVs. Collaborating with other healthcare providers, CCNs work closely with doctors, surgeons, and other nurses to provide safe and appropriate care. Advocating for patients, CCNs may represent patients' wishes, such as following a healthcare directive. Providing comfort and palliative care, CCNs help patients manage pain and discomfort, and participate in decisions about limiting life-prolonging treatment. Planning for rehabilitation, CCNs help patients improve their level of functioning and quality of life. Using advanced medical technology, CCNs use equipment like ventilators, dialysis machines, and cardiac monitoring systems. Adapting care to a patient's changing condition, CCNs must be able to respond quickly to changes in a patient's condition. Working in stressful situations, CCNs must be empathetic and compassionate while dealing with patients and their families who may be highly emotional. Being prepared to make tough decisions, CCNs must be calm and caring while making objective decisions.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.